you. Can you have this all wrapped up, Obamacare and a tax reform package, by the August recess?
Well, David, judging from the disarray that the Republicans are in right now and trying to figure out which direction they want to go on health care, I can't see that getting done by August by itself. And they have to do that before they tackle tax reform. So I think that timetable is pretty unrealistic. You know, the timeline from the Republicans has slipped now from the month of February now toward August. And I think what they're realizing is what we already knew, and Donald Trump apparently figured out yesterday, and that is that doing health care reform is really complicated.
Yeah, he did say that, actually, in remarks to the governors, that it's really complicated. But take us into the process and give us a sense of this timing here. We haven't seen a specific proposal of the Republicans yet. When do they have to have that worked through their own caucus of Republicans before they present it to the American people and to you?
Well, I mean, the timing's up to them. There's really no deadline on that. The only thing that's a factor is, and this gets a little bit into the weeds, is that they're working on the repeal and replacement of Obamacare through a process called reconciliation, which requires only 51 votes in the Senate to pass. That has to be done before they can use the same reconciliation process in the 2018 budget to do tax reform. So they have to do health care reform before tax reform, which again I think pushes the entire agenda back considerably into late in the year.
So give us some sense of your timetable as you look at things from what you know. When do they have to present something in order to get it done by August? When are you going to have to see some pen put on paper?
Well, you know, they're in charge of the process, so literally they could do it within a few days' time. And the only requirement, which they have violated a number of times, is that the legislation is posted 72 hours before it's debated. So literally they could go up till the end of July before they present it to us or to the country.
Simply put, Congressman, is the problem they're facing, on the one hand, they want to save money, on the other, they don't want to knock people off of health insurance?
Well, exactly. They're finding out that the promises they have made, kind of generic promises of patient-centered care and affordable care and quality care and all of these freedoms and choices, aren't easy to orchestrate in a complicated process like this. I've been saying for months and months and months, the only real alternative to the Affordable Care Act, other than going back to where we were before it, is to go to a single-payer or a Medicare for All plan. I'm fine with looking at that, and I think many in my caucus would be as well. They don't want to go there, so they're finding out now that all they will be able to do is tweak the Affordable Care Act, which, remember, is a Republican plan that came out of the Heritage Foundation.
So to cut to the chase and ask what may be an unfair question, if you're advising one of the members of our audience, a business CEO, somebody who's on Wall Street, and they say, okay, when can I realistically expect real tax reform, what would you tell them? What's your best estimate?
I'm saying I really would be surprised if they get it done this year. I'm not confident they can get tax reform done at all. As we spoke the other day, you know, the outside world makes it very difficult to do something this complicated. There'll be 10,000 lobbyists, literally, working on tax reform legislation. And then you've got all the outside advocacy groups that'll make it very difficult. And they're going to have to rely on Democratic votes as well. So if they keep advancing this agenda where the top 1% is going to get a $200,000 a year annual tax break and middle America is going to get about just over $1,000, that's something they're going to have a hard time selling, not just to Democrats, but also to the American people.